Welcome back to Dental Vibes. I'm Gabby.
And I'm Carla.
And we hope that you have watched our other videos on drama in the office and how to recognize a bad boss. And today we're going to kind of stay in the topic. By the way, if you have not watched those videos, we're going to link them. Make sure you go and like them, okay? We're going to talk about how can you find the office that's going to be the right fit for you. Is there a dream office out there?
Yeah, we definitely get a lot of questions about that, and we get also a lot of messages from you guys about all the bad experiences that you've had, how you're struggling. And you know, we're here to tell you that yes, that dream dental office for you exists. The key is finding it. So we're going to talk about how you can find it.
So we have put together a list because when you talk about finding the right office for you, you need to have your priorities listed. And that office needs to check your priority list. Right. So it's going to be customized for everybody because everybody have different needs and priorities and situations. So we're going to talk about main things that you should look for. And then obviously we'll talk about what is our main thing for our perfect office.
Yes.
So the first thing will be hours, and this is super important.
Yes, that is big because this is really how you're gonna fit that job into your life, you know, and how you're gonna be able to work for this office. A lot of people, they forget. They're like, oh, you know, I'm so desperate for a job that I'm just gonna take wherever I'm given. And it's like, I mean, I've been in that situation when I was a newbie, but at the same time, you gotta take a step back and think about like, wait, do I have any commitments after work? Do I have to pick up my kid? Do I have to go to school? Any activities? Or, you know, if there's an office that offers you hours like from 6:30 until 2, can you even be there somewhere at 6:30? Because I can't.
Well, technically you have to be there probably like 6. So that means you gotta get up. I don't know what time, and then
I don't even know.
Me personally, it'll be no.
It'd be a no, definitely. Not even once a week. I can't.
No, it's too early. So yeah, I mean, trying to figure out if you have any anything going on after work, if you're gonna be getting out on time, that's something that you can find out at your interview. Be like, okay, well, you guys, you know, finish at 4, but what time do the assistants leave?
Right. That's very important. And I just want to tell you too that if they ask you, they're like, okay, our last patient is out by 4, but you stay until 5, right? Because between picking up, finishing your charts, etc., you know, they are counting on you to be there until that time. So it is a little bit messed up if like 6 months down the road, you're like, oh, I can't really meet that schedule. You know, then you're gonna create a problem for yourself. And you know, what do we do?
Yeah, whenever I was looking for an office, I would always make sure, hey, because, you know, I was working on my undergrad forever. So I was like, you know, this day and this date, I have class. I have to leave here at 4 on the dot. And that would be discussed on my interview. And if they're not okay with that, I'm not going to take that job because at the end of the day, I need to look out for my needs as well. So that's very important. The other thing, my number 1.
Yes, that is my number 1.
Lunch. Some people don't mind. They would just snack here and there. They don't care about their lunches. Some people would rather get out early and not have a lunch. That's completely fine.
And how long of a lunch do you get?
How long of a lunch do you get?
Do you need a full hour? Is it just 30 minutes? There are offices that do 2-hour lunches, but then you're leaving probably later, 6, 7. Yeah. So you definitely want to clarify that.
You definitely want to clarify that. That is probably my first question in interviews is like, do you actually block time on the schedule for a lunch? Because I need my lunch. So whatever works for you, you know, you want to make sure that you're aware of what you're walking into.
Tell me what you think about this, though, because there are times when they would say, yes, you can have a lunch, but the other assistant always stays through lunch and the doctor always works through lunch. I'm very hesitant about those situations because I do feel like the other assistant, we don't know what her setup is, and they could get resentful towards you. And even if you go like, hey, I set this up in my interview, like, sucks for you, But I just don't like it when it's like, if you're gonna be singled out, that you're the only one getting lunch. Yeah,
I agree.
I'm questionable at those kind of places.
Yeah, I agree. The other thing that we have is benefits and pay. Again, this is custom for everybody. You know, if you are on a younger side, you might not really care for health insurance.
Right.
You know, maybe you're getting a fair hourly pay, so you're like, you know, I'm fine with that.
Yeah.
Some people, they would like a full benefit package. Some people's like, oh, you know, if I have just paid vacation or paid holidays, I'm fine with that. The rest is the rest. So whatever works for you, you need to discuss that before you accept a job.
Make sure that also whatever you accept, most likely that office is not going to change the amount of benefits that they give you. So if you're like you said, you know, if you're on the younger type of age, you're like, oh, I don't care about medical insurance. You're like, okay, but you know, once you've been in 10 years, what does that look like? Or retirement plan, you know?
Yeah, that's a big one because I hear a lot of assistants getting closer to their retirement and they're like, oh, you know, my office doesn't have a retirement plan, never offered it, like they're complaining about it. Obviously it sucks, but again, why did you stay there?
Yeah.
You knew this was a priority to you. There's other offices that are gonna offer you that, so look for those offices.
Right.
Don't just stay in an office that doesn't give you what you need. You know, and as far as pay too, you know, whenever we are talking with newbies, it's like sometimes you do have to start somewhere and you got to start on a lower rate, but you should always in your interview set up, okay, well, I will take this offer, but I need to have my 90-day review, because if I do show improvement, which I know I will, I need a raise. And how often am I going to get raises?
And we talked more about this in our video of dental interview, so make sure you check that out. We're gonna link it below. I think a lot of people that are like, oh, okay, you're gonna offer me that, okay, that's good, and then you just like want to leave the interview, but you just gotta keep it together during that time, get all your questions answered and lock things down then, because then it's gonna be very difficult to change things.
Exactly. The other thing, and this is I mean, all of them are important, but this is super important for me personally, is a vibe check.
Are we vibing
or not?
And you know, it sucks, but this is the truth. And I think actually it applies to any job out there, that you may go in and you have the skills and you're like, I did everything right, but they just didn't call me back after the working interview. Well, maybe they didn't like you, and
like your personality.
I hate to just put it plainly like that, but you know, you're just as much as they are judging you, you should be judging them. Number one. So if there's something, if the doctor's a little cuckoo and you're not about that, or
if there's a coworker that's like bossy and you're not down with, like, I mean, you need to be like, have your aura open when you go for the working interview. To absorb that and say, okay, this is not gonna work out for me or not. And if they don't call you back and you feel like, oh, maybe they just didn't like me, okay, just move on. Just move on from that. You know, better for you. Don't force it. Don't force it, because you know, the worst thing is for you to be stuck working for a doctor side by side, 40 hours a week, and you don't vibe. Like, that is the most uncomfortable situation to be in. Or with your coworkers too. I mean, you don't have to be best friends with everybody, right? But you want to make sure that is an environment where you have each other's back,
that it's friendly,
that you wake up in the morning and you're like, you know, I'm okay going to work today. You know, it's gonna be a fine day. But it's super important for you to make sure you check that on your working interview. Look around, check where your coworkers are doing, check what the doctor is doing. Another thing, if you like the doctor's work or not, because that's super important. If you trust that doctor, how does that doctor treat the patients? How do they treat the team? How do they treatment plan? Are they greedy? You know, so all those things. And again, everybody's gonna have a different perspective when it comes to that, but
that's a big giveaway.
It's a big giveaway. And like, for me personally, I know I would be miserable if I worked at like a super conservative office where like the doctor is super serious.
Because you're cray-cray.
But you know, it's like, if you have to walk on eggshells and you can't be yourself, that's a long period of time for you to not be yourself.
Right. Yeah.
So you want to make sure that people are like you.
Yeah. And like, you know, at the beginning, it's always going to be a little some tension because you don't know these people, and then you're like getting to know each other, but it shouldn't be like, oh my God, a burden. Like I don't know how to act at all. Shouldn't be.
And I just thought about this that I have to mention. Another thing, it's like when you're there for your working interview, ask around.
Oh yeah.
It doesn't matter if like the question is super odd, ask, because I've heard this too.
Moments later, more moments later.
Okay, we're back. So what I was saying is an example, right, that I actually heard several dental assistants say. You know, my doctor is vegan and we're not allowed to heat up meat in the office.
Damn, I never heard of that, but I can believe it.
That's not cool. Like, I would not be happy in an office like this. So, you know, it might be weird for you to ask on your working interview all these random questions, but I would just try to get a really good feel of the office I'm potentially gonna work at, you know? And the last thing that we're gonna talk about is growth.
Oh yeah, this is a big one. And here we're talking about what's the technology like in the office. Is there growth opportunities for you, not just like position, but your city credits? Does the doctor trust you? You know, is he or she like to delegate, especially if you're expanded functions? You know, you want to be able to use all that knowledge that you learned in your program, that you got all the certifications for, that you gotta keep up every year. So it's a lot, and this is, for me, it's important. I do want to be in a place that a practice that it's growing and that is helping me grow, because hey, at the end of the day, if I'm growing, if I'm motivated, the more I put into the workplace, and we're all moving up, you know what I mean?
And you will feel better about your position. You feel happier. A lot of dental assistants complain that they feel like they're the bottom of the, you know, of the office. And you know, if you're challenging yourself and you're growing your pride of your work, then you're not gonna feel like that. You're gonna feel like, you know, I'm proud of myself. I do a great job. I'm learning new things. I'm getting better. It's very important.
Yeah, and I think, but you also have to see it on everybody, because who you surround yourself with, that's what you're becoming. So the dentist needs to be on that. What is the dentist bringing into the practice every year? I mean, we keep hearing it for you. You're like, I can't do paper charts, you know?
Yeah.
I mean, it is 2021, so for sure, if I hear something about film x-rays, I'm just like, I don't even know what to say, you know?
So, you know, and again, this is gonna be completely different for everybody, because there are some assistants out there that they're like, you know what? I just want to be in an office where it's laid back, the doctor is old school, I don't have to do much, I don't have to get out of my bubble.
Yeah.
If that's your vibe, that's fine, but you have to find an office that's like that too, so then you'll be happy.
Right.
But if that's not your vibe and you want to be in a high-tech place and you want to be where you're going to grow, you can't accept a job at an old school office, because you're not going to be happy and things are not going to change there. You're not going to change that doctor. So you want to make sure that you know what you want and the type of office that you want, so you can get that. So we're gonna end this video with a little bit of tough love.
Because we care.
Because we care, and you have to know this.
Yes.
Now, you have your list of priorities, and you want all these things from this office.
Yeah.
But what are you giving this office? Because I will tell you, a lot of dental assistants out there, they want to make $1,000 an hour and get all these things from an office, but they have a $10 hour performance. And we have to be realistic, and we have to look at ourselves in the mirror and say, okay, well, I need to improve on some things. I need to, you know, deliver better skills to be able to get everything that I want from this dream office.
True. And then the second point would be, how will you hold yourself accountable if you know you got this job and maybe it was great at the beginning, but you've reached a point where it looks like a dead end, you still have that list. Maybe your life has changed and now you've added more things to your list. What are you gonna do then? You know, and I think that recognizing that end point, it's very difficult, it's very tough because change is tough, right? But that's the only way you're gonna keep growing. And it's okay that you've been, arrived at this place. What it's not okay is that you're gonna keep pushing yourself, burning yourself out, and then one day you're gonna snap and just be like, no, I hate this place, I'm going, not coming back. And it's like, whoa, 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 whoa. So now you just spent all that time, burned bridges, and you're not gonna hated dentistry, you're miserable, and now you don't even have a work letter. What am I need? A reference letter. See? So you don't want to do that. You want to leave that place. Or by the way, let's take a step back. There are some things that could be changed,
because nothing is perfect. Even your dream office is not going to be 100% perfect.
So like maybe there's something that could be worked out. Hey, it never hurts to just ask, let's have that meeting in your review, bring up your concerns. How can we improve as a team, or whatever you think the office needs or that you need from that office to stay. Bring your concerns up, because you never know. I mean, we say that, okay, maybe things won't change, but the truth is they could. And you gotta give them that opportunity. And now, if it doesn't, then that's when you gotta recreate that list that we keep talking about and move on,
And then when you're interviewing for this new dream office, right? Then you want to make sure to stick to that list and make sure that you're not leaving your situation for the same situation.
Right.
You are leaving your situation for a better office that's going to better fit your lifestyle.
Absolutely.
So as always, please make sure you like this video, because we are here from all of your support. So
and
please
subscribe to our channel.
Subscribe to our channel if you haven't. Also, let us know in the comments, what's your priority list? What do you want from your dream office? And we will see you guys next time. Keep smiling.